You are listening to the Ion New York podcast for Friday, February 5th, 2021. I'm Robert Harding, the Citizen's Political Reporter, and this podcast is presented by The Citizen. Today's guest is State Senator John Mannion. Mannion represents the 50th Senate District, which includes parts of Cayuga and Onondaga counties. Mannion joined me to discuss his first month and a half in the state Senate, as well as some of the issues on the table at the moment, including the state budget, his new role as Senate Disabilities Committee Chair, and the recently released nursing home report. This was the report put out by State Attorney General Letitia James regarding the COVID-19 response in nursing homes. And that's actually the main story today. But before I get to that, wanted to make an announcement, which is the podcast will be posting every Friday from now on. Tried the Thursday thing. I am busy for a good chunk of the week, and so Friday just seems to be a better fit. And so that's what I'm going to start going with. I'll be publishing the podcast every Friday morning, and that's when you can find new episodes. The new episodes will be available on auburnpub.com, the Citizen's website, and also on iTunes, Google Play, and Spotify. So wanted to make that announcement just to clear up. I know I came into 2021 really trying to get back in the habit of releasing a weekly podcast. Really haven't met that goal yet, but February is a new month, and hopefully we'll get off to a better start here and get into a routine of doing this every week. So looking forward to posting these on Friday going forward. And again, you can find them on iTunes, Google Play, Spotify, and auburnpub.com. So with that, I'll get to the main story, and then you'll hear from Senator Mannion. I won't take too long, talking about these stories, but I definitely wanted to use this time to highlight a big news story in the last week. And so to recap, State Attorney General Letitia James releases this report. It's a product of 8 months of investigative work by her office looking into the COVID-19 really crisis in nursing homes. And there were several key findings. One you've heard a lot about, I'm sure. This has been covered extensively by those of us in the print and digital media, also on TV, but it deals with how the state has compiled and released certain data regarding nursing home deaths, specifically COVID-19 nursing home deaths. Now, up until last Thursday, the information that we had was the number of confirmed and suspected COVID-19 deaths in nursing homes. These are residents who died in a nursing home, but the State Department of Health did not include nursing home residents who were transferred to hospitals and later died. That figure has been missing for months now. Again, up until last Thursday, we did not have a full accounting of the death toll in nursing homes, and so it was difficult to really assess just how bad this was. We knew it was bad. A lot, thousands of people who live in nursing homes have died of COVID. We know that from the numbers, again, that the state put out. They, up through last Thursday, there were over, I believe, 8,000 confirmed and suspected deaths, but those were just in the nursing homes. It didn't include the number of people who died in hospitals, nursing home residents who died in hospitals. Over time, there have been different estimates. There's even an estimate in the Attorney General's report. That estimate was pretty close to being on the money. That estimate was that the number of COVID-19 deaths in nursing homes was undercounted by about 50%. That's been a similar estimate shared just based on the numbers that were compiled from different examples of nursing homes that may have had a number of nursing home residents that died but not all of them happened in the nursing home. Some of those deaths occurred in hospitals. So there was this gap there, again, in the accounting of this. And, the Attorney General's report came out hours later. State Health Commissioner Dr. Howard Zucker issues a statement responding to the report's key findings and addresses this gap in the data and reveals for the first time that 3,829 nursing home residents died after being transferred to a hospital. So that's in addition to, and this is based on his numbers, which cover March 1st, 2020 through January 19th, 2021, there were 5,957 deaths within nursing facilities, 3,829 within a hospital. Then you add that with, at the time, there were 2,957 presumed fatalities in nursing homes. So you put that all together, you put those numbers together, and you have almost close to 13,000, but well over 12,000 nursing home residents who've died in New York due to COVID, either confirmed or presumed cases. So it's a significant number. And the full accounting, it certainly paints a dark picture of how the crisis in nursing homes was handled. It's not just a state government problem, it's a problem for the many of which are private nursing homes. And the report put out by Attorney General James's office goes into some of the detail about why this may have been worse than it should have been. It deals, the report, some of the key findings include, various infection control protocols and how those were executed or not. The staffing levels. One of the findings in there was that there's these federal staffing ratings, and so the facilities with lower staffing ratings tended to have the higher COVID-19 fatalities, and so that was a point of concern that was raised. Also, insufficient personal protective equipment and testing. We knew that we knew staffing was a problem too, even before the pandemic, but we were certainly aware of the situation with PPE and testing supplies, that there was a real lack of equipment and testing supplies in nursing homes. This was being talked about in the early days of the pandemic, that this was a problem. It was a problem too for hospitals, many of which were overwhelmed, especially in the downstate area during the first several weeks of the pandemic here in New York. And PPE and testing were hard to come by. It's gotten better over time, but now we're moving to a different phase of this, and so now the focus is on vaccinations, and there were certainly some challenges with getting access to the vaccinations, but there has been progress on that front as well. So, again, a lot of key findings in that report. There was another one that I didn't get to, didn't mean to overlook it, but it deals with government guidance, and they do talk about this directive that was put out by the State Department of Health. It was issued March 25th, and essentially, and I'll summarize it because it was a one-page or so document, but basically the guidance said that a nursing home could not deny admission or readmission to a resident solely because of a COVID diagnosis or even a suspected COVID diagnosis. And then it goes into, there was another part of the guidance dealing with, I believe, testing, that readmission shouldn't be contingent upon a negative COVID test. So, that was another key finding in that report. There were some other issues addressed there related to nursing homes and the state's handling of it. As you look through this report, it was like a 70-page report, so there's a lot to digest there. And this is going to be, and I did talk to Senator Mannion about this because it's really going to turn, uh, now at this stage, it's really going to turn into a job for the state legislature. Where does this go from here? What reforms do you make to address a lot of these concerns, a lot of these key findings in this report? And there's more to come, by the way. The Attorney General's office mentioned that they're still doing investigations into over 20 nursing homes. That number could go up, but this isn't over, and it's certainly not over from a legislative standpoint because there are obvious questions about, what should the legislature do to, continue this investigation, maybe launch an inquiry of their own, or take action to make some reforms to address this so that it doesn't happen again, and to really tackle some of the problems that are longstanding problems with nursing homes and other facilities in the state. Staffing is one thing that comes to mind. I just did a story a short time ago about nurses at a local hospital. That hospital, there's actually an affiliated nursing home with it, and these problems exist not only at the hospital but also at the nursing home. And so staffing is a real concern. So where does the legislature go from here is a great question to ask. And there could be legislation coming. We'll see what they do. I did ask Senator Mannion about that, so you'll hear from him shortly about what he thinks. But this is going to be something that, obviously the pandemic isn't over. And, there's going to be a lot of different reviews done to figure out what could the state government do better? What could the federal government do better? What could the local governments do better? What could these different facilities, whether we're talking about hospitals or nursing homes, do better? It's really going to take an extensive review. And there should be some recommendations that come out of that, and certainly legislation. There's some things that we know now that maybe can be addressed through legislation, but there might be other things that have to wait. I know that this isn't over. I know this because we've had an outbreak in Cayuga County, right in our backyard here. When we talk about nursing homes, there's a good number of these deaths that occurred early on in the pandemic, March, April, maybe into May. But as it went on, especially over the summer, it wasn't so bad in many areas. Then we got into the fall, and it certainly changed. But for us, we didn't have a COVID death in a nursing home here in Cayuga County until December. We were one of the very few. There was only a handful or so counties that did not have a COVID death in a nursing home, and Cayuga was in that group up until right around Christmas time. And what you take away from that is just how bad it can get quickly. In this one facility I cover, the Commons on St. Anthony in Auburn, there were at least 48 deaths in that nursing home. Now, at the time I first reported on the outbreak there, they had 259 residents. So just think about that. Think about how many residents, the fraction of that. It's a considerable number of people who died. And that doesn't even count the people who contracted the virus, of which, based on our understanding, that there were certainly a lot of residents, probably about half of the facility at least, that contracted it. There were more employees who had it. So it was really a problem at that nursing home. And unfortunately, at least 48 people died. There's another nursing home in Auburn, Auburn Rehabilitation and Nursing Center. They've lost 2 residents. I should say at least 2 residents. And the reason I say that is that the local health department, Cayuga County Health Department, based on their situational updates, there have been at least 56 nursing home deaths in Cayuga County. So you add the numbers up that I just gave you, and you might wonder, well, there's 50, you say 56, where are the other six? Well, according to the health department, 6 of those nursing home residents who died were hospitalized. And so we don't know, based on that, because of the way that the state has compiled this data, we don't know where those 6 residents came from initially, whether it was the Commons, whether it was Auburn Rehab, another facility. We just know that 6 nursing home residents died in the hospital. What we do know is that, the minimum numbers I gave you, the 48 and the 2, those numbers could easily be higher. It's just unclear because of how the state compiles it. And, the facilities really haven't been forthcoming with this information lately. That's another thing that should be looked at is the disclosure of this information. I think the state plays a role. It'd be easier if they just released the number, of nursing home residents who died in the hospital. But, really it should be the facilities that are being transparent about this. And unfortunately, that hasn't been the case. So there's a lot to look at with this story. Again, it doesn't end here. There's going to be a lot more nursing homes, I think, that are going to be looked at because there have been more outbreaks since the end of, the period that this report covers that was released by the Attorney General's office. You're talking about from March through mid-November. Well, since then, especially with that post-holiday surge that they talk about, we have seen some outbreaks in nursing homes. So that's going to require, presumably, more investigation. And, there could be more findings that come out of that because, those outbreaks happen at a different stage of the pandemic. Now that we're several months in, it's worth looking at, okay, what went wrong here? Was PPE still an issue? Was testing still an issue? That doesn't seem to be the case. So what else, was there something else that happened here that led to this? Was there any, were there any mistakes made by the facility? Were there any issues with the state government's role? So these are all things that still need to be looked at, and that's why I say it's not over yet because, these investigations are going to continue. And that list of findings could increase. We could see more as time goes on here. So, again, that was a big story last week. It remains a major focus, and I think as the legislative session goes on, you're going to hear more about this and what actions need to be taken. So, with that, I will get to the interview with State Senator John Mannion. Again, Mannion represents the 50th Senate District, which includes parts of Cayuga and Onondaga counties. My guest today is Senator John Mannion. Senator, thanks so much for joining me. The first interview on the podcast as a state senator. So thanks so much.
Well, thank you for having me on, Robert. It's always a pleasure. And, we'll see if anything's different now that I'm in elected office, but I don't think it's going to be. I don't think so. So
sure.
Anyway, thanks again for having me on.
Yeah, thanks for doing this. I think a good place to start is, you were able to get a bit of a head start just because of, the technical nature of your election and the fact that this seat was vacant for so long. How was that head start helpful for you to really get the ball rolling as January came and the start of session and the budget season, of course?
I cannot tell you how helpful it was. And as there are 13 other brand new senators, some of them are coming from the assembly, but it's amazing how much there is to do. And therefore, if they stepped into the spot right away in January, you're immediately into the legislative session. I actually mentioned that to somebody who's been around for a while in the state legislature, and they chuckled at me because they said that, this is just the way that it is. But you do get thrown right into the fire, and I was very thankful to have those 2 weeks. I feel for the other senators that didn't because, we try to be really proactive. we knew that there was a lot of other elected officials, from cities or villages or towns that we wanted to engage in and set up meetings and hear their concerns so we could make sure that when we got to the budget or we got into the legislative session that we were there, we were knowledgeable and we could help. And, now that we're into it here about a month, the schedule is, it's an exciting one, but it's a busy one. And that involves, sessions, but also budget hearings and our own various committees. So there's a lot to do. And, it literally, as you can imagine, it's making sure how the phone and the intercom and the voicemail works. Sometimes that takes time. And the fact that we had 2 weeks to do those things that I think we can all kind of relate to is, it was absolutely necessary. Then we had a chance to do what we really wanted to do, which was to make sure we engaged with a lot of the folks, and we did. And we feel like we're very prepared going into this.
I know early in January, you were named chairman of the Senate Developmental Disabilities Committee. This was before it was merged with, I believe, mental health, but it was broken off to focus specifically on developmental disabilities. How important is that assignment for you? And, especially with your educational background, what do you think you bring to that committee in terms of your expertise? Yeah,
well, I am honored to be able to chair this newly established committee. As you said, the powers that be, and I have great respect for Senator Andrea Stewart-Cousins, and I'm really happy that she entrusted with me, this position. It's just such an important one, and I do come at it from the perspective of teaching kids that had developmental disabilities. But additionally, I'm not going to go into too many details, but I've had my own experience with it within our family, and therefore it means a lot to me. This is a population that deserves to be treated with dignity, and we all have challenges in our lives, and these individuals have their challenges that are in many ways unique, in many ways similar, but they need our support. And I vow to be a strong voice for that community. I come with a mind that is pretty knowledgeable about that world, but also a heart that is there to make sure we get it right for these folks and their families, because, as I said, they deserve to live in a dignified manner, and there's times where, unfortunately, I think the system has missed.
What types of, in terms of that committee work, what types of bills do you expect to see come out of that committee this session?
Well, there's a lot of things. One would be that we have a lack of stability when it comes to some of our residential facilities, and we have to make sure that that stability is there, not just for the people who live there, but also the families and the employees. So in Syracuse, New York, here we had concerns a few years back about the closing of Hutchings Psychiatric Center. And we want to make sure, one bill is that we make sure that we have some power over that we can have these rapid changes that are going to cause great disruptions of the lives of individuals. And therefore, one of the bills that we're going to advance, and I know you reported on, was to make sure that there is at least a 1-year timeline where if there is going to be a change, that there is a cohesive plan, and that we make sure that these people settle in the right spot and input is provided. Another bill that's out there that we're going to hopefully advance is called an ombudsman bill, which is to help families navigate through the process. I will say that, from my experiences and stories that I've heard, when you have a child who has a developmental disability and they are newly diagnosed, it can be overwhelming. You certainly want to put the child at the forefront of your attention, but you also have to navigate through the system. And it's not as easy as you might think, maybe as you may not think, maybe you might be not so surprised that there is a lot of red tape, a lot of forms to fill out, and it can be complicated. So it's things like that that are going to go through this committee. We've got a lot of others, and we are engaging those organizations that are trying to advocate for these individuals and say, listen, this is something we're missing, and we've spent a lot of time meeting with those groups to make sure that we don't miss anything, and we prioritize legislation to help this community.
I did want to get your reaction. I know that you did put out a statement about this, but wanted to go in a little bit more detail in response to the report that was released by State Attorney General Letitia James. Well, when this comes out, it might be a week or two more, but this was at the tail end of January, and there were a lot of different findings in there. Of course, the one that's received the most attention is the release of data or the lack thereof by the State Department of Health. I wanted to start there first. Those numbers represent people, nursing home residents who died. There was the State Department of Health had a technicality that said they only counted them in the facilities, not if they were transferred to hospitals. What do you make of that whole ordeal? I mean, this was dragged out for months, and finally, it was within hours of the Attorney General's report being released that the Health Commissioner released this data. Just what do you think about this and the effect it had on so many families and that overall count?
Well, it's a very challenging time for everyone, and there was a lot of talk about this for a very long time, that people felt like the numbers did not accurately reflect what was happening. And you have the people in the nursing homes themselves, be they staff or residents, and then you had the families, and then you had the media that said, it seems like something is not being reported here. And because it was a very challenging time back in the spring to try to get this right, we, that some hard decisions were made. So the fact that there were decisions that were being questioned, and then also along those lines, we are questioning the number of reported deaths. These families and these individuals that live there deserve transparency. They deserve it, and they deserve really very open and honest, and to some extent aggressive transparency. It should be overly transparent when we're talking about individuals that are living in homes where we're limiting human contact, and there's already issues within those homes related to staffing, related to their reimbursement rates, and trying to pay their staff a fair wage. I know from my interactions with organizations that represent those staff or the staff themselves that they're spread too thin. And as a result, it has created a situation that is, at the brink a little bit. And now as we look at the Attorney General's report, and I think there'll be more coming out on this, this is what an Attorney General's office is there to do. It's to make sure that things are running correctly, that there is transparency. So therefore, how do we go forward here? Well, I think there's going to be obviously greater scrutiny. I think there needs to be a set of checks and balances like there is. And these families deserve to know. They deserve to know. And this is what the Attorney General is in a position to do. That is what she did. And just like we have this at the state level and expect it outside of any partisan politics, we expect that at the federal level as well. There's a lot of important entities when it comes to, this country and this state, and an independent Attorney General, be it at whatever level, is a very important part of that process. And, this needed to happen.
I wanted to ask you too about other aspects of that report, because I know a lot of the attention was on the data and the lack of transparency there, but there were also some disturbing I think findings. It's preliminary. There's still some investigations ongoing, but it's related to staffing. Some of these facilities. I believe the Attorney General's finding was that the facilities with the higher rates of death tended to be those with lower staffing levels. And then there was insufficient personal protective equipment and testing, among other things. So, there really seems to be, I know that a lot of the focus is on state government and the state health department specifically for various actions, but there's also a lot of concern about the state of nursing homes. What do you think the state legislature's role is in addressing some of these findings released by the AG's office and potentially making some reforms to the nursing home system here in New York?
Absolutely. We need that transparency, like you said, but there are other issues that are in that report, and I heard them as long before I was elected when I spoke with, like I said, representatives of organizations that represent staff and the people that are running those homes. We can do a lot, and we have to do a lot. And I believe that there has been a lot of aggressive advocacy in that area. The Medicaid reimbursement rates are not providing these facilities with enough funds to be able to properly do what they need to do, and that includes paying their staff a fair wage. What we have seen is that some of these facilities are competing with retailers that can pay the same wage as these people that are providing the care that's necessary for family members, and that is unfortunate. And it really is more than just a chain reaction or a snowball's effect. It is putting them in crisis, and that they may have to close. They can't hire enough staff and pay them and retain them a fair wage because of the reimbursement rates, and then some of the other changes that were embedded into the law as it relates to like vacancies and reimbursement when there is a vacancy that occurs, either short-term or long-term. These facilities have to keep the lights on. They got to pay their staff. They have insurance to cover, and it really has put them in a tough spot. So we can do things legislatively to get that right. And in this new budget, there's already conversations about how we can make changes to the executive budget to try to get it right. And as the chair of the Disabilities Committee, that's my job, is to try to get that done. Also there are dollars coming from the federal government, be they from FEMA or other parts of the stimulus package, that we got to get to these facilities because we need them. We have an aging population here, and we all deserve to live out our lives in dignity, and the families and the residents certainly deserve that. And unfortunately, I think what we've seen is in some of these facilities that have been bought out by larger entities, it hasn't gone as well as we had hoped.
Let's shift to the budget since you mentioned that. Obviously, this is a complicated budget year. There's a $15 billion deficit that the governor's office says needs to be addressed. Before I get to the federal piece of this, I know that there's federal aid being pursued, but at the state level, what do the priorities need to be to ensure that certain key areas, education aid, I know is in your wheelhouse, healthcare funding, these types of things that are essential. How do you balance the budget while also ensuring that those are properly funded?
Exactly. Well, those are you mentioned two big ones, right? And we're all hopeful that those federal dollars come in. And I know that the governor's budget has basically said, here's a couple scenarios. We're going to get some help, or we're going to get $6 billion, $15 billion, or somewhere in between. And I'm glad that if it comes, but part of what you see within the budget is unfortunately that those federal dollars that we assume are coming are allowing areas of the budget, including in education, to have that aid level dropped. And the problem is that is going to set a precedent that when we go to the 22-23 budget, we're going to be working off of those numbers, and that's going to be a problem down the road. So that's just one aspect of it. That we're hopeful for those federal dollars, but we've got to get that right, and that's just in the world of education. I was on a legislative briefing held by, OCM over here in Onondaga County, BOCES, and Dr. Rick Timms did a great job of that. That's one part of it. But also to close that $15 billion budget gap, even in the executive budget, and the governor has spoken about a tax on the ultra wealthy and how he thinks we either should avoid it or we have to be very careful. That as I've said, whether it comes from the legislature, it comes in the executive budget. The ultra wealthy have done very well across this country, specifically during the pandemic and in the state. And what we've seen over a couple generations is that the tax codes have been very favorable for them. And if we just maintain the levels that were present, like in the early 80s, we may not have the funding and the revenue issues that we have. So all we're doing is talking about making some very careful and calculated adjustments to the tax code in the state that would impact the ultra wealthy who have benefited from the systems that we have in the state. So we're giving that consideration to try to help to close the budget gap. And as we spoke about before, aside from taxing the ultra wealthy, there's some other places that we can look to. But there has to be some prioritizing within the budget. I think a lot of that has been done. We're hoping for our federal stimulus dollars, and we're hoping for additional streams of revenue. And we're going to make sure that those are a part of the budget that comes out of the legislature.
Just a couple more questions to close. First, I wanted to focus on COVID. Really, two parts of the COVID-19 pandemic. First, the health response, and certainly, I think a lot of focus now is on the vaccine. It seems like we've really met the challenge of testing. Testing has been ramped up and seems to be there's enough supply there. Now the question is, can we do the same thing with the vaccinations? I know that there's obviously some complicating factors here. You're dealing with corporations and the federal government, but from the state perspective, how can we make it easier to get these vaccinations deployed and into arms in a much more quicker fashion? Because I know that that's been one of the frustrating points right now, is that the supply is limited, and then who's getting the vaccine, there seems to be some question of who's getting it and who's not.
Well, we twice a week, my team or I participate in a regional COVID call, which has been helpful. And we have at least one staff person dedicated to helping people secure these spots to get a vaccination. I also have written a letter, and we'll be releasing another one about going back to the disability standpoint, prioritizing about 80% of that group that don't live in residential facilities that may have challenges as it relates to securing these appointments or transportation, that they really should have been prioritized also. And that's an important piece of this. But as far as how the state goes, I do agree that I think the counties where we're working in here, which would be Cayuga and Onondaga for me, I've seen them do a great job as it comes to testing, spin on a dime, utilize their staff who have gone above and beyond. Now we have things complicated, and part of it is because of the supply. It's very discouraging. I will tell you that within our conference in the Senate, there is, calls for greater transparency when it comes to that and answers, and that can be a little bit contentious at times because we want answers also. We represent these people, and we have populations that are not getting this vaccine and have concerns about getting the second dose. So we are a very strong voice in communicating with the Department of Health at the state to make sure that we get it right. I will say, like I just mentioned, in Onondaga and Cayuga County, they did a great job with testing, and I think they're ready to do a great job with vaccinations, and they're frustrated because of some of the outside forces that have complicated things a little bit, and that includes the vaccine supply.
And then the other half of COVID, the economic impact of this. What do you think the state's role should be, in terms of helping businesses? I'm thinking of the restaurant industry that's been ravaged by this. There have been restaurants in Central New York that have closed due to the pandemic. So, I know at the federal level, there's been a proposal to have a restaurant, type grant program.
Yeah.
Do you see something similar coming for New York State?
I do. There is a package of bills, small business package to help support those struggling businesses and specific areas of it for sure. And what is encouraging is in the executive budget, there's $50 million earmarked to help with some relief for specifically, mostly in the restaurant industry. So I'm glad that that's there. I think some people have seen that rolling back a little bit on some of the regulations has been positive, and I think some of those will get extended to try to help these groups. But they need help, they need help, and they have been, many of them, good partners. I was a strong advocate in trying to get these yellow zones and orange zones out of the way. I am all for public safety, but what we've seen, yes, we want to be safe, but unfortunately what we've seen is that the lines are kind of arbitrary. If you're an establishment and you are going to carry out safe practices in your establishment and people want to go there and enjoy food or drinks there, they should be able to do that, because when the lines were drawn, what we saw is people just not going to those establishments. They were driving a half-mile away and they were going into others. So I think that we're in a better place when it comes to that, and that certainly was due to advocacy for myself and other legislators. So I think if we relax some of the regulations, and if there's anything good that has come of this, one of those things is that we're revisiting, I think, some of those regulations. And then also, they need help. They need stimulus dollars. They need grants or loans where they can be able to, pay their bills and reestablish. Many of them have done a great job in retaining staff so that they could retain their benefits, and I applaud them, and then we got to support them.
I'll close with this question because I think it's interesting in your case. Obviously you came from a career in teaching. You taught for over 25 years, and obviously you've shifted to this new role. How much do you miss the classroom, and how did that experience really prepare you for being a state representative?
I, of course, miss it. I love it. I've done it for 28 years, and I wish my colleagues the best. I know they're going through a lot of a lot of challenges, and they've just done a fantastic job. Makes me proud to say that I'm a teacher. I think there's a lot of, I said this when I ran, I think there's a role for elected leaders to be teachers, to be educators, and to educate in a smart way and a positive way, so that we don't get caught up in the political climate, and we are transparent and transmit a message and try to go deeper than, no offense on this, but just the headline, to understand the issues. You do that, Robert, for sure, and I appreciate that. But I think that's part of it. And then also, I think, when I have stood in front of a classroom, I had to deal with multiple different personalities and different priorities in those kids. And I did it in a very apolitical way. And I did it because, politics shouldn't come into the classroom. And in many ways, we've become overly politicized. So when I have to interact with a group and I know that they might be looking for me to, well, I guess I would say, they may not like some legislation that they think I support, and I have to listen to them. I represent an area that has a lot of Republicans and a lot of Democrats and a lot of independents, and I've got to represent all of them. And I think that I'm doing that already and will continue to do it. So, in the classroom, again, lots of personalities, lots of, not just my students, but parents also, and lots of different views and different priorities for them. So I hope I bring that perspective to the legislature and in my interactions with meetings and advocacy and things like that. So, it's certainly been helpful, and I wouldn't trade it for anything.
Senator John Mannion, who represents the 50th Senate District, which includes parts of Cayuga and Onondaga counties. Senator, thanks so much for joining me today.
Thank you, Robert. Stay warm out there.
That was State Senator John Mannion. Thanks again to the Senator for joining me on the podcast to discuss the early several weeks of his term in office and some of the issues that are obviously important to his constituents as well as residents of New York State. Again, going forward, I'll be posting the podcast every Friday. It just seems to be a better fit. I think that that's going to be the plan going forward. It's going to be easier to post the podcast this way instead of the middle of the week, which tends to be a little bit busier for me. So hopefully this works out, and I'll certainly pledge to post this podcast every Friday because I really do want to get the ball rolling with this and make it, more of a regular thing that people can expect. Coming up next week, I'll be joined by Justin Wilcox, who is the Executive Director of Unshackle Upstate. Justin joined me to discuss the advocacy agenda for Unshackle Upstate. This is something that they release every year right at the start of the legislative session, some of their priorities for the session, some of the things that they want to see out of the State Assembly and Senate. There's some different priorities in there that shouldn't be too surprising given the group's background, looking at tax rates and the scaffold law, prevailing wage, just to name a few. But we do get into some of the other aspects of the advocacy agenda. For example, one of the items that's mentioned in there is broadband. This is something that's been talked about a lot. And so, I did ask Justin about, how do we ensure that folks have access to high-speed internet, which remains a challenge in some areas of the state still. So those are all conversations that you'll hear next week. Again, Unshackle Upstate's Executive Director Justin Wilcox will be my guest. So looking forward to that podcast. So until then, thanks so much for listening, and I'll talk to you next Friday.